How are you? It's October 6th, 2019, and so we're going to go right into the course and let you know what's up. We as a team are furiously grading the discussions and critical thinking assignments, and we'll be done this week, just to let you know, so you know how you stand there. Everybody's doing a fabulous job, so I really wouldn't worry about it. Just, do remember all the emails that Julia has been sending out about being careful about presenting your own work, okay, about the concept of plagiarism. It's just a really, really important thing because it's something you need to learn, not for performing well in school, but really for doing well in life, professionally, all right, because if you submit work and represent it as your own when it's not, it could be your undoing. And Julia was managing counsel for a large corporation and had many attorneys working under her. And a case was going to trial, and she asked one of the associates working under her, a lawyer, to submit a memo that would be presented in court, and the person just lifted it. Unfortunately, she discovered it, and through using something very similar to turn it in, had to call the guy into her office and had to fire him, and that's a big deal. So just get used to taking pride in your own work, and the more you do it, the better you're going to be. All right, awesome. So what we're doing now is we're going into the next week's assignment, and that is metabolic syndrome and diabetic heart disease right here. And again, if you have any questions about plagiarism, you can go right in here, and we have a discussion on that. Okay, so and it's right in here. In fact, I'm going to do it anyways and go back because that's the way I roll. Okay, how to avoid plagiarism, and you click on that, and it does take you to the tutorial, okay, that USC offers. All right, so I'm just throwing that out there. Okay, all right. Keep an eye on upcoming dates. Okay. So the next one is CT2, again, a short paper, all right? And it's due on the 21st. And you might consider right now looking over the interview paper, identifying some person that you would like to identify, like your parents, your grandparents, your aunt or uncle or something like that, and get the ball rolling on that. Okay, alrighty, it's kind of amazing when you look at all the topics that we've gotten through already, so I'm really proud of you guys. So this right here is going to be connecting diabetes to other conditions, okay? And we call it metabolic syndrome because so many different aspects of your physiology is diseased, okay? It's pathological, and it puts you at high risk for hospitalization. It puts we call this a morbidity. When somebody's sick, scientists call it a morbidity, and it's got a personal toll. You can't do the things you used to be able to do. It's got a financial toll, whether it be daily medication or frequent hospital visits. And then it has a huge toll on your family in terms of the caregiving we're doing. And we'll see down here, we're going to be going over caregiving right here and what social workers do. A big part of caregiving is family, okay? Social workers help out as well. All right, so this builds on the section on diabetes, and diabetes is a huge problem, okay? 10% of our country, like I said, approaching 35 million people have diabetes, and diabetes then puts you at risk for vascular disease and its consequences, okay? One consequence is a heart disease because the blood vessels, the big giant blood vessels, when your heart pumps, it sends this immediate offshoot, circles around into the coronary arteries, and it supplies the muscles of your heart with blood rich in oxygen, glucose, and other types of nutrients. It's because your heart never stops. Boom, 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 boom. It's constantly going in really, really at high metabolic levels. So it has high demands, okay? If you get diabetes, it then initiates this process called atherosclerosis, which is vascular disease. And as a result, you don't adequately supply the flow of blood to the muscles of the heart, and they begin to die off. It's a slow, progressive disease, all right? and it's heart disease. My dad died of congestive heart failure, and this is just one example of this, okay? Stroke is another problem, okay? Again, by having diabetes, the blood vessels, again, this is, what happens is the big blood vessels that immediately leave the heart. The brain, is 2% of your body weight, but it consumes about a quarter of all of your oxygen and glucose. So there's a huge pipe that comes straight up from the heart called the carotid artery, and it gets caked with this vascular disease and puts you at super high risk for having a stroke. And that's a lot of morbidity, a lot of cost, and it really, really weighs down on the family members that are doing the caregiving. Okay, so these are all the PDF files, just in case you have trouble with accessing this link. You shouldn't, and we just want you to kind of review through it. So you click on this right here, okay, and it takes you to the National Heart, Lung, and Blood Institute, and it allows you to look at metabolic syndrome. It allows you to familiarize yourself with it, to see what it's all about, okay? Alrighty, so metabolic syndrome, like I said, it's a group of risk factors that put you at risk for health problems, and part of it is diabetes and stroke, okay? If we look at, what are the big deals? Again, if you don't have blood flow to the heart, you have this ischemia, okay? And it's because of this atherosclerotic plaque right here. So you can just click on these and go back and forth. So I can look up plaque. What is plaque, okay? And you see how it highlights it right there for you. So it defines it for you. Sometimes it'll take you to another link in the website, okay? So what are the big risk factors for this metabolic disease, okay? The big risk factor is fat posited in the waistline. So we have this, again, this obesity epidemic in privileged, westernized, industrialized, whatever you want to call them, countries, okay? And they call it the apple shape because you carry all your weight, like you look like a leg and arms coming out of a big giant apple, and that's why they call it an apple shape, okay? And it refers to excess fat in the stomach. It becomes really, really kind of infectious in a way. So what happens is the immune system goes running in there and starts gobbling up fat cells. They get too big and explode. And the immune system, all it knows to do is what it does, and it's this huge inflammatory response, okay? Just like when you cut your finger, okay, and it gets all red and swollen because the bacteria got in there, the immune system runs in there and it gets red and inflamed. It looks like flames underneath the skin. That's why I remember that. But you don't need that happening chronically over 10, 15, 20 years in your stomach. And when that happens, then all the inflammatory messages go everywhere in the body, and it combines with the consequences of diabetes, which is this candy coating of all the different pipes and candy coating of proteins. And then the other part of this metabolic syndrome then is you tend to have an elevation because of all the fat and because of the diabetes of triglycerides, and this is how you cargo ships carry these fats around. So if you have an In-N-Out burger, you package it into triglycerides and you cart it around all throughout the body, and it's at high risk for causing these deposits. Okay. The other thing that is, a big risk is your total cholesterol is high, and your what's called your lousy LDL can be high. Okay. Other thing that happens is the HDL tends to get low, okay? And what makes for high levels of HDL? Exercise, a plant-based diet, low levels of stress, all right? So these are all these things. A doctor will tell you this when you, or your, hopefully this won't happen to you or your family member, but this is the first line of defense is behavioral changes, okay? Going to drugs is, there are non-specific effects, and there's no free lunch with drugs, and it's not something you want to do when you can do it by changing your behavior, right? Genetically, it's a bummer. If you have a family history, then you're at super high risk, okay? Alrighty. Again, so it goes through all these different things, okay? And you see metabolic syndrome is associated with this rise in obesity rates, and it is linked to insensitivity of our insulin receptors, which is type 2 diabetes, okay? So we go in here, again, we look at over the risk factors, okay, overweight, obesity, and insulin resistance. What is insulin resistance? Insulin resistance is age-related diabetes, the kind we've gone over. There's a really, really small number. Remember, type 1 diabetics? That is juvenile. It's because of a bizarre tweak in your immune system where it attacks the insulin secreting organ, the pancreas in your body. This is far different. This is chronic. It takes oftentimes decades, but it starts early. You know, we have this obesity epidemic in youth. Okay, all righty. Risk factors. Okay, so it tells you who has a risk factor. People that have a personal family history. Again, genetics. People who have siblings or parents. Genetics. Okay, so you can sit side by side. Okay, with somebody and have the same level of exercise, same level of nutrient intake, okay? You eat the same level of In-N-Out burgers or fruits or whatever. One person can get diabetes and metabolic syndrome and the other one doesn't because we're all very different, okay? All righty. We look here at some socioeconomic right here. We see that Mexican Americans have the highest rate, okay, followed by whites and blacks, okay? And it is genetic, okay? So, and also just, you know, kind of a cultural thing, all right? All righty. So this goes through heart disease risk, okay? And again, this is a big risk, okay? And it's all about scoring, and this is what clinicians and people that study this will do in terms of ranking it, okay? Screening and prevention, super important. We're going to look at, like I said, your total cholesterol, your LDL, which is L's for lousy, because that's the one that deposits all the cholesterol and triglycerides directly into the walls of the artery, and it causes them to get swollen. Okay, really, really nasty thing. Okay, sorry, let's go back over here. What else do we have? High blood pressure, because you have the same volume of blood, but now it's caked full of crud in the pipes, so it just has to push harder on these smaller pipes. High blood sugar levels, because you're a diabetic, reduces the flexibility of pipes, and also will further the development of the plaques we see here. How are we going to screen for this? Okay, you're going to do a diabetic screen on this. Okay, so you're going to look at your fasting blood glucose. You're going to look at your glucose challenge test, where we give everybody the same level of drink that has a known amount of glucose, and we look at it 2 hours later. And the other thing is hemoglobin A1C, and it looks at how much sugar has coated that hemoglobin A1C. If you have high blood sugar levels because you're a diabetic, more of it is coated, and it's a good readout. All right, we're going to obtain this from a blood test, and another blood test is to look at all of your lipoproteins. I do this annually. Your parents should do this annually, because then you can change your lifestyle, or, you know, sadly, you might have to start taking some drugs like statins that will lower your cholesterol. All righty. All right, so signs and symptoms, okay? The signs and symptoms are going to be high blood pressure, okay? High blood sugar, okay? So just go through that. Diagnosis, we kind of went over that, okay? High triglycerides, low HAPI, okay? High blood pressure because the pipes are no longer flexible and they're caked. They're caked with blood sugar, okay? This also results in more obesity. And these again are the blood sugar levels that you'll be looking at, okay? This is the cutoff for HDL. You should have this amount. So talk to this with your parents and grandparents. Where do they stand, okay? You don't want to be in excess of 150 here, okay? All righty. You want to be higher than 40 here, okay? Stuff like that. All righty, cool. All right, so that's the drill on this week's assignment. So you go through all this. It's then summarized by watching this really short video. Look at that, it's unavailable. So what I'm going to do is I'm going to put in the video that is available. Let me see. Bum, 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 bum.
We are being censored. America's news outlets no longer provide the truth. I'm John.
So that's what we're
Atherosclerosis
gonna watch.
is a life-threatening disease that may have begun to develop during childhood. This condition is a process in which deposits of fatty material, called plaque, build up inside
that, okay? And what we then go into discussions, okay? A big part of caregiving is caring over elders that have all these conditions, okay? Who's going to get them to the doctor, right? Who's going to make sure that they are taking their drugs? Who's going to ensure that they have a plan? Help them with their diet to control their disease process, okay? Help them with bills, things like that. So this is a great study on social workers as caregivers. Essentially, I was a social worker for my mom, okay? And in a way, my wife, Julia, is for me when I'm having surgeries because I blow it out from being an athlete, and I've helped her with her cancer. So, but then when you don't have anybody, you have these people. Okay. We also wanted to throw this in because we don't have much of opportunity to go over elder abuse. So here's a section on elder abuse, okay? And social workers are also, while they're helping you with your needs, are evaluating constantly because they have a fiduciary role to report evidence of abuse. And this goes to the different types of abuse that are out there, whether it's physical, emotional, financial neglect, okay? And then if you're an aficionado, this is the DA's office in San Diego. Long video, but it's well worth watching. All righty, so I am sorry for this one. So what I'm going to do is I'm going to go in right before your very eyes, and I'm going to get rid of that thing because that sucks. Okay, all righty. And this is how we do it in Blackboard. All right, so I'm just going to go boom, and then I'm going to hit my friend. See here, delete. Okay, awesome, and delete. Okay, cool. Awesome. All right, so I'm going to save that as is. All right, so there you go. So a short video right here, just go into right here. So for some reason this video doesn't allow you to do it, but I really like it. It's because it's trademarked. It's all good. All right. Okay, so that will do it, my friends, and we will see you next week.